You're watching Eagle News America. I'm Thomas I. Likeness, broadcasting from our studio in Edmonton, Canada. It's Monday, March the 15th, 2021 on this side of the globe, and a good Tuesday morning to our viewers in the Philippines. In the news today, we have updates from several of our correspondents from across North America. Mayan Manzano-Garzon in Sicklerville, New Jersey, will talk about the governor's pick to serve on the state's Supreme Court. You'll also hear from Arlene Ocampo in Port Washington, Maryland.
Restrictions are lifted in Maryland.
Eliza Gonzalez Manglik Mott in Washington, D.C.
How fully vaccinated people can meet safely with others, according to CDC guidelines.
Andre Ritutar in Panorama City, California.
Los Angeles County now in red tier of California's blueprint for a safer economy.
Rachel Wainer in Toronto, Canada, will tell us a story about how much care packages mean to overseas Filipino workers struggling because of the pandemic. Oh, plus we're going to hear from our EBC friend Jim Sewell in Pensacola, Florida. He's going to teach us how to build our own raised vegetable garden bed. And for tonight's roundtable, let's ask our team what they'd build if they could. Our coverage begins now. A lot of new words became part of our everyday vocabulary this past year. Coronavirus, COVID-19, herd immunity, to name a few. Now another one. A word that in the beginning offered hope, but is now striking fear in some. Astrazeneca. The Astrazeneca vaccine developed in the United Kingdom held a lot of promise initially. It was cheap, initially claiming a high success rate, but then clouds appeared on the horizon. The effectiveness turned out to be much lower than Pfizer and Moderna. South Africa returned 1 million doses, saying it just gave minimal protection against a more contagious variant in that country. And now there are reports of blood clots and severe allergies following immunization. What is the World Health Organization saying about all of this? Well, WHO Chief Scientist Soumya Swaminathan says countries should continue to use the AstraZeneca formula.
The question really is the linkage with the vaccine, and this is why we need to look at all of the data. The experts are looking at the data, and so far we do not find an association between these events and the vaccine, because the rates at which these events have occurred in the vaccinated group are in fact less than what you would expect in the general population at the same time.
AstraZeneca has not been approved for use in the United States, but it is being injected into the arms of Canadians. And earlier today, Canada's Prime Minister, Justin Trudeau, said he has no problems with it.
Health Canada and our experts and scientists have spent an awful lot of time making sure that every vaccine approved in Canada is both safe and effective. Therefore, the best vaccine for you to take is the very first one that is offered to you.
But with all of the reports of problems elsewhere in the world, there's some hesitancy here. Anecdotally, I have heard people say they will pass on a chance to get the AstraZeneca now and instead wait for a different product. Well, let's look at the COVID-19 numbers now, provided by the Coronavirus Resource Institute of the Johns Hopkins University in Medicine. As of 6 p.m. Eastern Time today, the number of cases of COVID-19 reported worldwide are more than 120,096,000. Top three on the list of countries with recorded cases: United States, more than 29.4 million. India, more than 11.4 million. Brazil, more than 11.3 million. And sadly, this virus has claimed more than 2,657,000 lives. Top three countries with the most number of COVID-19 related deaths are the United States with more than 535,000, Brazil more than 278,000, and Mexico more than 194,000. In the United States, many prominent people and political leaders have been very vocal about promoting the country's immunization campaign. But White House Press Secretary Jen Psaki says one name that is noticeably absent is former President Donald Trump.
The living former president, or most of them, if not all of them, has participated in public campaigns. They did not need an engraved invitation to do so. So he may decide he should do that. If so, great.
Trump's voice in the campaign could boost participation. You know, polls show that Republican men who are overwhelmingly supporters of Trump and his Make America Great platform, well, they're the ones leading the resistance to getting vaccinated. Trump and his wife, Melania, incidentally got their own vaccines before they left the White House in January. But unlike President Joe Biden and other current officials who went on live television to get immunized, Trump, and for him it would be a highly unusual move, kept his own vaccine private. The FBI says the bomber who blew up his vehicle in downtown Nashville last December 25th acted alone and had no ties with terrorists. This was the conclusion of a report that the FBI released today. Anthony Quinn Warner of Antioch, Tennessee, detonated a homemade bomb in his van. He killed himself, injured at least 3 other people. The FBI says the explosion was an intentional act by Warner to end his own life. It says he was driven to it by paranoia, long-held beliefs that he had from eccentric conspiracy theories, as well as failing relationships. The FBI says Warner chose the location and the timing of the bombing to create the greatest impact while minimizing harm to others. That camper van blew up in downtown Nashville in early December 25th. The blast came after Warner played a taped warning message over a loudspeaker, and that gave nearby residents time to evacuate. The explosion in the U.S. country music capital damaged about 40 buildings. In Beijing, a dense yellow haze hangs over the city. The Chinese capital was cloaked by thick smog today. Pollution rose to hazardous levels as a sandstorm swept across the city. People used goggles, masks, and hairnets to protect themselves from the choking air. Visibility reduced to about 1,000 meters. That's 3,000 feet. Landmarks, including the Forbidden City and the distinctive headquarters of the state broadcaster, CCTV, were partly obscured behind the curtain of pollutants. Classes in schools were canceled, along with outside sports and events. People with respiratory diseases were told to stay indoors. The poor air quality was due to a sandstorm in northern Mongolia. We'll take a moment now to bring you up to date on a couple of stories from Canada. This first one affects both Canada and the United States. You know, if you're thinking of paying a visit here to Canada, you can't unless it's essential travel. Prime Minister Trudeau told us today the border will remain closed for another month. This coming Sunday will be the 1-year anniversary of the restrictions that forbid non-essential travel between the two countries. So, how long before we can freely cross like we used to? Well, Prime Minister Justin Trudeau says, not for a while.
But I think we're all going to wait patiently until such a time as the health situation allows us to loosen border restrictions internationally. That'll be eventually, but not for today.
There's still traffic going both ways across the border. That's to allow about $2 billion worth of goods that's being shipped between the countries every day. On another issue, Trudeau was asked when he's going to roll up his sleeve for the COVID vaccine. He says, well, he doesn't plan to jump to the head of the line.
I'm focused on getting vaccines for as many Canadians as possible, as quickly as possible, not overly focused on when my turn will come. When it comes, I will gladly get vaccinated, but I will wait my turn.
And he's definitely not in a high-risk group, good health, only 49 years old. Well, the vaccine rollout in Canada has been going at a snail's pace compared to many other countries. Up next, we'll have stories from New Jersey and Maryland. Eagle News America continues.
Events happen around us all the time, in our community, in our country, around the world. Events that affect people, move communities, or simply inspire us. Interesting events that people need to know. In these interesting times, we continue to be a competent partner in delivering news about these events. Fast, accurate, balanced. Eagle News, because we live in interesting times.
Hey there, Arnie Aquino here at Hatley Castle, one of the filming locations for the X-Men series. Don't forget to tune in to Digital Nest only on Net 25.
Watching Eagle News America, I'm Thomas I. Likeness. In New Jersey, there's an upcoming vacancy on the state Supreme Court. Eagle News correspondent Mayan Manzano-Garzon gives us some background on the governor's choice to fill that spot on the bench.
Thank you, Thomas. Governor Phil Murphy today announced his intention to nominate Rachel Wainer Apter to the New Jersey Supreme Court to fill the seat of Associate Justice Janie Lavechia, who will retire at the end of the current court term on August 31, 2021. The appointment will first be sent to the New Jersey State Bar Association's Judicial and Prosecutorial Appointments Committee. With the committee's approval, the governor will proceed with a formal nomination subject to advice and consent in the Senate. Weiner Apter currently serves as director of the New Jersey Division on Civil Rights, the state agency charged with protecting the civil rights of all New Jerseyans. The division is responsible for enforcing the New Jersey law against discrimination, the nation's oldest anti-discrimination law, which prohibits discrimination on the basis of race, creed, color, national origin, ancestry, sex, age, marital status, sexual orientation, gender identity, disability, pregnancy or breastfeeding, and a variety of other protected characteristics in the workforce, places of public accommodation, housing, and lending. The division is also charged with preventing and eliminating discrimination in New Jersey by both receiving, investigating, and acting upon complaints alleging discrimination, and by affirmatively issuing reports and publications, conducting investigations, and implementing educational and community outreach programs to address systemic discrimination. Prior to her current role, Weiner Apter served as counsel to the Attorney General advising on civil rights and immigration matters, including leading the New Jersey team that defeated a motion by Texas and 7 other states to end deferred action for childhood arrivals, or DACA. United States Court Appeals for the Second Circuit, and led a task force regarding investigations into incidents of sexual harassment and sexual assault on college campuses. Justice. Rachel graduated from the University of Pennsylvania summa cum laude and received her law degree from Harvard Law School magna cum laude. A native of Rockaway, New Jersey, Rachel lives in Englewood with her husband Jonathan and 3 children. And for New Jersey's latest COVID-19 numbers, the Department of Health has reported another 2,468 new positive cases today, bringing our statewide total to 744,499. Sadly, we are also reporting 23 new confirmed deaths, pushing the total to 21,451 fatalities. But on the brighter side, the latest total of COVID-19 vaccinations already administered here in New Jersey is now 3,007,152. And Thomas, for a quick weather update, it's currently 34 degrees Fahrenheit here in New Jersey, or -1 degrees Celsius. In Sicklerville, New Jersey, May and Manzano Garzon, Eagle News, we live in interesting times. Back to you, Thomas.
Love that weather, Mayanne. It's just almost like spring there. We go to Maryland now, where they're easing restrictions. They're easing COVID restrictions there. Arlene Ocampo standing by in Fort Washington with the details. Good evening, Arlene, and thanks for joining us.
Thank you, Thomas. With key health metrics going down and the ramping of vaccinations being given, Maryland Governor Hogan announced the lifting of restrictions. He said that this is a positive step in the right direction and an important part of our economic recovery. Here are the updated health metrics as of today. The state of Maryland is at Phase 1C with 697,800 Marylanders being fully vaccinated. Currently, there are 777 hospitalized, 7 deaths in the past 24 hours, and the positivity rate is at 3.85%. Indoor and outdoor dining capacities have been lifted along with indoor recreational establishments, hair and nail salons, fitness centers, houses of worship, and retail businesses. Seated and distance service will have to be followed by restaurants. Large indoor and outdoor venues such as wedding, concert, theater, and convention venues can operate at 50% of its maximum capacity. This also includes outdoor entertainment venues, sporting and racing venues. There are some jurisdictions that have chosen not to totally lift the restrictions, but ease up on them instead. In Montgomery County, indoor dining will remain at 25% of their maximum capacity until March 26th. Thereafter, it will be at 50% of their maximum capacity. Fitness centers, retail services, nail and hair salons will operate at 25% of their maximum capacity. Houses of worship can operate at 50% of their maximum capacity. Here in Prince George's County, all of the following can operate at 50% of their maximum capacity. Indoor and outdoor dining, theaters, fitness centers, banquet halls, reception and meeting rooms, houses of worship, personal services such as hair and nail salons, and retail businesses. If it's not mentioned in the executive order, indoor gatherings are allowed 20 people max and 50 people max for outdoor gathering. This is exciting news, but let's not be complacent. Let's not put our guards down, but see this as one step closer to normalcy. Wearing of our mask is still in effect. And as always, continue to keep our distance, wash our hands, and when it's your turn to get vaccinated, please do. In Fort Washington, Maryland, Arlene Ocampo, Eagle News, we live in interesting times. Back to you, Thomas.
Very, very definitely do not become complacent. We become the enemy then at that point if we forget all of those just basics of hygiene and public health. And we don't want to end up back in that lockdown. Now, I heard there's a new platform to register to receive the vaccine in Maryland. Can you tell me more about that?
Yes, thank you, Thomas. Currently, there are already numerous ways to register to receive the vaccine, but this particular platform is only for the mass vaccination sites here in Maryland. This will actually put you on a contact list. And once the appointments are available, they will contact you based on your preference, so whether it be via text, email, or even a phone call. So one can actually pre-register online at covidvax.maryland.gov or by phone through the state's COVID-19 Vaccination Support Center at 1-855-MD-GO-VAX or 1-855-634-6829.
Arlene, can you just let us, can you just let us know where those mass vaccination, having trouble there, say that 3 times, mass vaccination sites are located at?
Yes, thank you, Thomas. Currently, there's one here in Prince George's County at the Six Flags America, and then the other one is at the M&T Bank Stadium. It's in the Baltimore area, and there's one, it's the newest one that has actually just opened in Southern Maryland at the Regency Furniture Stadium. Now, these are actually within about an hour from each other. There are actually 2 more sites that will be opening soon in the Eastern Shore area and in Western Maryland. So by the end of this month, there will be mass vaccination sites at all regions here in the state of Maryland. Thomas?
Arlene, enjoy that newfound freedom you've got there in Maryland, but do stay safe. Thanks for joining us.
You.
Still to come, we've got stories from Washington, D.C. and California. This is Eagle News America.
Kumanta, sumaya tayong lahat. Saya.
Factual.
We have to defeat the virus everywhere.
Timely information. Balanced, not only in the country, but also abroad.
I'm certain of one thing.
Interviews that people need to know. Watch Aguila Pilipinas. A 1-hour newscast of reports coming from regional hubs in Luzon, Visayas, and Mindanao. Know the important updates in Asia in ASEAN in Focus. Track the latest stories in the provinces in Aguila Provincia. Tune into Mata ng Aguila, the evening primetime news program of Net25. Balanced and objective, Mata ng Aguila covers national and international issues, tackles news on business, health, science, and technology, entertainment, sports and human interest features, and current events. And Eagle News International delivers the latest global reports, impartial, accessible, and up-to-date. It brings to fore EBC's rich international scope and access to valuable information streams.
Well, thank you to explaining our help outdoor.
Catch these programs on Net25. You can also watch our news programs through eaglenews.ph and Eagle News Facebook page and YouTube channel.
You're watching Eagle News America. I'm Thomas I. Likeness. Okay, so you've got both of your shots. You're fully vaccinated now. So what's next? Well, joining us from the nation's capital now, EBC's Eliza Gonzalez, Manglik, Mott. She's going to tell us how fully vaccinated people can mingle safely with others. Thanks for joining us, Eliza. Good evening.
Thank you, Thomas. Good Monday evening to you and a good Tuesday morning to our viewers on the other side of the globe. You are correct, Thomas. When are people considered fully vaccinated against COVID-19? According to the Centers for Disease Control and Prevention, they say you are fully vaccinated against COVID-19 2 weeks after your second dose in a 2-dose series like the Pfizer and Moderna vaccines, or 2 weeks after a single-dose vaccine like Johnson & Johnson's Janssen vaccine. If it has been less than 2 weeks since your shot, or if you still need to get your second dose, you are not fully protected. Now, the CDC advises to keep taking all prevention steps until you are fully vaccinated. Now, once an individual has been fully vaccinated, he or she can start to do some things that he or she had stopped doing because of the pandemic. Now, here are the things you can do if you are fully vaccinated. Indoor gatherings with fully vaccinated people without wearing a mask, that's okay. Indoor gatherings with unvaccinated people from one other household, take note, just one other household. For example, visiting with relatives who all live together, without masks are okay, unless any of those people or anyone they live with has an increased risk for severe illness from COVID-19. Now, if you've been around someone who has COVID-19, you do not need to stay away from others or get tested unless you have symptoms. However, if you live in a group setting like a correctional or detention facility or group homes, and are around someone who has COVID-19, you should still stay away from others for 14 days and get tested, even if you don't have symptoms. Now, things you still have to do even if you are fully vaccinated. What are these? You should still take steps to protect yourself and others in many situations. You still need to wear a mask, stay at least 6 feet apart from others, and avoid crowds and poorly ventilated spaces. Now, take these precautions whenever you are, number 1, in public, 2, gathering with unvaccinated people from more than one other household, 3, visiting with an unvaccinated person who is at increased risk of severe illness or death from COVID-19, or who lives with a person at increased risk. What else? Medium or large size gatherings should still be avoided. Domestic and international travel should be delayed. Now, if you do need to travel, you still need to follow CDC requirements and recommendations. Watch out for symptoms of COVID-19, especially if you've been around someone who is sick. If you have symptoms of COVID-19, you should get tested and stay home and away from others. You will still need to follow guidance at your workplace if you work. Now, for some weather update, Thomas, it's 45 degrees Fahrenheit or 7 degrees Celsius here in the nation's capital. In Washington, I am Eliza Gonzalez, Manglik, Mott, Eagle News. We live in interesting times. Back to you, Thomas.
I think the big takeaway I got from your report there, Eliza, was that vaccines do not make you invincible, and they're not a free pass to do whatever you want. You can't go back to what we were doing back in 2019, before the pandemic.
That's correct. They're not.
So what does the CDC say they know and are still learning when it comes to COVID-19 vaccines?
Now, in a published statement, Thomas, CDC is saying that they know that COVID-19 vaccines are effective at preventing COVID-19 disease, especially severe illness and death. Now, what CDC is still learning is how effective the vaccines are against variants of the virus that causes COVID-19. The CDC says early data show the vaccines may work against some variants, but could be less effective against others. Now, what other things does the CDC know? CDC knows that other prevention steps help stop the spread of COVID-19, and that these steps are still important, even as vaccines are being distributed. CDC is still learning how well COVID-19 vaccines keep people from spreading the disease, because early data show that the vaccines may help keep people from spreading COVID-19, but we are learning more as more people get vaccinated. Now, if some are wondering how long COVID-19 vaccines can protect people, that is still being studied. Thomas?
Yeah, and we hear that maybe a booster will be required. It may become an annual thing like a full flu shot, but it's really too early to say on any of that. Can you give me an update on how the vaccination is going, though, in D.C.?
Well, here in the district, according to coronavirus.dc.gov, the total doses administered as of today is at 231,118. Now, the percentage of the first and the single doses administered in the district is at 86%. The percentage of district residents partially or fully vaccinated now is at 14.2. So still a long way to go, but we are getting there. Thomas?
Are you getting any closer to the top of the list, Eliza?
I wish. One day I'll say yes to that question. One day, but almost, but not yet.
Well, hopefully soon. Do stay safe and look forward to talking to you during the roundtable at the end of the program. We go to Los Angeles County now, where more restrictions are being lifted as economic activity resumes. And to tell us more, we're joined live from California by Eagle News correspondent Andre Ryututar. Andre, tell us more.
Thank you, Thomas. Los Angeles County is now in the less restrictive red tier of California's blueprint for a safer economy. Last Friday, the state officially announced that 2 million residents in the most vulnerable areas of California have received the COVID-19 vaccine. According to the recently updated blueprint guidance that takes into account this vaccine equity, this announcement means that the threshold to be categorized in the less 3 restrictive tiers will increase, giving the 58 different counties of the state a better chance to move down the framework and open more businesses, including sectors, to the public. The requirement to shift from the most restrictive purple tier to the lesser restrictive red tier has changed from 7 new COVID-19 cases per 100,000 residents to 10 new cases per 100,000 residents. With this new update, Los Angeles moves to the red tier since the case rate of the county has already been below 10 new cases per 100,000 people for the past 2 weeks. Restaurants can now provide indoor dining once again, but limited to a 25% capacity. There still needs to be a minimum of 8 feet distance between tables and only 1 household per indoor table with a maximum of 6 people. Students from grades 7 to 12 can go back to in-person learning and instruction at their schools. Movie theaters are allowed to reopen with 25% indoor capacity limit, but 6 feet physical distancing must still be observed between groups and single households. Gyms and fitness centers, including yoga and dance studios, can provide indoor services with 10% capacity. And for our younger residents, family trips to indoor museums, zoos, and aquariums are possible again with a limited 25% capacity. Public health orders to reopen these various businesses and sectors throughout Los Angeles are effective today, but required safety protocols must continue to be followed. Barbara Ferrer, the public health director, states, "We urge everyone to use caution and good judgment in these next critical weeks and months to avoid surges in cases, hospitalizations, and deaths like we saw at the end of 2020 and the beginning of 2021. Don't let your guard down. Continue following all safety measures, stay masked, maintain at least a 6-foot distance from others, and keep in mind outdoor activities are far safer than indoor ones." In Panorama City, California, Andre Ryututar, Eagle News, we live in interesting times. Back to you, Thomas.
And again, Andre, that same message, use some good judgment and don't let your guard down. Great advice. Los Angeles residents must be smiling today because, you know, all those restrictions you mentioned that are lifted. What other restrictions that are in place now can they expect to be gone?
Well, actually, Thomas, there are more. Indoor shopping malls, retail, and personal care services have been open at a lower limited capacity, but now at this red tier, they can increase their indoor capacity to 50%. Even greater news are that the food courts inside these malls can now reopen with 25% capacity. And for those missing that interaction with families, Angelinos can gather indoors with up to 3 households. If everyone in the group are fully vaccinated, which means they have received their last dose of the vaccine at least 2 weeks prior, indoor gathering of a small group without masks and physical distancing is now allowed. This is one of the newest guidelines adopted by the Los Angeles public health officials to be aligned with the released CDC guidelines of those vaccinated. Thomas?
Well, not wide open yet, but getting there. Getting there. Can you update us on who's next on the list to be vaccinated for COVID-19 in Los Angeles County?
Well, Thomas, with the loosening of restrictions here, more residents will also be eligible to be vaccinated. Starting today, Angelinos 16 years old to 64 years of age with underlying health issues and disabilities that make them susceptible to contracting the virus can set up their appointments to receive the COVID-19 vaccine. In addition, public transit workers, airport ground crew employees, janitors, and custodians are also able to now be administered the vaccine. LA public health officials are looking to receive an expected shipment of 260,000 doses next week, and by the end of this month, more shipment to arrive, including the Johnson & Johnson vaccine. Thomas?
Thanks for joining us, Andre, and we'll see you a little bit later at the roundtable. Do stay safe. Up next, we have stories from Toronto, Canada, and you're going to be out in the garden. Our friend Jim Sewell will be instructing us on how to build a raised vegetable garden in our roundtable tonight. If you could build anything, what would it be? You're watching Eagle News America.
One for the money, two for the show. Okay, all right. Hello, videookers. It's me, Elvis Presley. Este. Marcelito Pomoy. Watch out for our retro episode coming very, very soon. All right.
Yes, that's right. Let's travel down memory lane as we sing and dance to the music of 80s, 60s, and 70s.
Oh naman! At makiblast na from the past, balikan po natin ang mga nakaraang masasayang kantan. Enjoy po ito, promise!
Dito lang sa kantahan at kainan at katuwaan, roll it one! Ito ang...
It's Singing Time!
It's Singing Time!
Lunes hanggang Biyernes,
Alas 8 ng gabi.
only here at Net 25!
Innovation, digital disruption, globalization. Startups, micro, small, and medium enterprises, as well as large corporations, all face interesting challenges in the market today. Peek into the world of exciting opportunities and partnerships to drive growth with the latest business news and information. We are open for business. Your weekly dose of entrepreneurial inspiration to update you on the latest developments in the world of business. Get up close and personal with CEOs and thought leaders to help you discover valuable insights, sharpen your instincts for smart decision making with the latest markets and economic trends, disruptive ideas, global innovation, social entrepreneurship, and other leading-edge business ideas. Join the conversations to create a more vibrant environment for entrepreneurship. Catch Open for Business, from vision to action.
This is Eagle News America. I'm Thomas Highlights. Well, in Toronto, Canada, EBC's April Masangsang reports that the pandemic has been tough on overseas Filipino workers. In her story tonight, she tells us how much care packages mean to these workers who are struggling.
The Church of Christ members in the Greater Toronto Area reaches out to overseas Filipino workers this weekend as part of their Aid to Humanity campaign. Overseas Filipino workers, or OFWs, are not exempt from the effects of the pandemic, on top of being by themselves in this part of the world. OFWs here in Canada have inevitably created a community for themselves to keep their spirits up and support each other. This sense of community is truly important as OFWs do their best to sustain themselves and their families back home in the face of a hard-hit economy. The members of the Church of Christ continues their efforts in serving their fellow men and offering this sense of community by giving their support in whatever ways that they can. One of which is through giving care packages and other useful food items. Here is one of the organizers for more details.
It's a link-up activity by the church administration to give link-up grocery items for those who need, especially in this kind of pandemic situation, so that we can show the people of this world that we also care for other brethren, even not yet member of the Church of Christ.
The OFWs are more than happy to receive the support, friendship, and community offered by the members of the Church of Christ. Take a listen.
I'm so thankful and blessed to be helped with people who are willing to help us living alone here in Canada and adjusting. It's so helpful for me because I'm running out of funds and I'm struggling with my finances here. So this is a big help for me.
In these times of uncertainties, economic instability and isolation, the sense of community and support, like what the Church of Christ members here in Greater Toronto offers, is what indeed most everyone needs. In Toronto, April Masongsong, Eagle News, we live in interesting times.
Any day now, depending on where you live in North America, well, it'll vary a little bit, but soon you'll be able to break out the gardening tools and start planting. And to give us a head start tonight, EBC friend Jim Sewell joins us to tell us how to build a raised vegetable garden bed.
To provide a bounty of nutritious garden veggies here in my backyard in Pensacola, I use raised beds. Most of our soil here in Florida is very sandy, so most garden vegetables don't do very well unless you add a lot of extra nutrients to the soil. But if you use raised beds like these, you can use a lot of compost and have some dark, rich soil like I have here. Raised beds also allow you to plant your vegetables closer together than regular garden because you can ensure your plants will have the food they need to produce tasty eats for your dinner table. We have a small backyard, but by using raised beds, we can grow the majority of the vegetables that we eat. Today I'm going to share with you how to build a raised bed like this one that's inexpensive and really easy to build. And will allow you a great way to maximize limited space like I have in my backyard. The first step in building a raised bed is deciding where you want to put it and remembering that you want it in a location that's going to get plenty of sunlight throughout the day. My yard is fenced, so I've avoided putting beds near the south side of my yard's fence since it blocks a lot of the sun shining from the south during the day. Most of my beds sit along the west side of my yard, and it's a great location because they get the morning sun from the east, and then the fence will protect them from that late afternoon sun that can get pretty hot. So I've got a good spot here. It's where I already had a bed, but this bed's been here for about 5 years, and the wood's starting to rot. So I'm going to replace it and also put in a little bit higher bed. Treated lumber will last longer, but this untreated lumber is really inexpensive, and treated lumber has toxins in it that can actually leach into your soil, and I try to keep my soil as chemical-free as possible. The materials you'll need to build your raised bed: 2 2-inch by 8-inch 8-foot-long boards, 16 4-inch wood screws, a drill with a 3/16 bit, wood saw, power screwdriver, tape measure, square, pencil, and level. You can use deeper boards, but remember, the deeper the board, the more soil you're going to have to use to fill up your bed. First, you'll need to cut both boards in half to create 4 4-foot lengths. Then, on 2 of the boards, I will drill pilot holes for my screws along each end. I will go ahead and assemble 2 of my box's sides by attaching the boards without the drilled holes. So now you can see I've got 2 corners of my raised bed completed, and now I'm going to go ahead and carry it outside since well, it's going to get a little heavy if I keep putting things together here in the garage. So I've got half of my bed in place, and I'm going to try to level it off. It doesn't have to be exactly level, but you don't want it too far off because when I put water on, I don't want it to run to one side or another. I want it to cover the bed evenly. So now I'm going to level off the front part too. That's not too bad. Dead on. I typically don't put any weed barriers at the base of my beds because the soil is deep enough that it's going to prevent any of the weed seeds from really coming up through the soil. The soil you use in your beds is going to be your most important choice. My favorite soil is using a mushroom compost, and you can find it in most garden centers. But I also really like to use my own compost. And since this bed has scraps that haven't totally broke down into compost, I'm going to put this compost on the bottom, and then we'll put my mushroom compost across the top to give the kitchen scraps a chance to break down a little more. I then finish filling my beds with my mushroom compost and will level it off to provide a nice, even growing surface for my plants. Buying compost to fill up a bed can get a little pricey, so I highly recommend getting your own compost bin and trying to make as much of your own compost as possible from your own kitchen scraps. Also, if you live in an area where there's a lot of horse farms or cattle farms, go make friends with a farmer. I guarantee that they've got some ready-to-use piles of compost somewhere on your farm that they'll just give you if you're willing to come pick it up. Also, a lot of the local sanitation departments now are taking yard waste and making their own compost. So check your county and your local city sanitation department. They may have some compost free of charge or very cheap. My wife and I always say health is wealth, and it means a lot to us to be able to produce healthy, nutritious vegetables for our family. Following organic practices and keeping our beds planted year-round provide us with most of the vegetables we need and help us to eat healthy and enjoy being outside together as a family. So I hope you'll be inspired to go out into your garden and build your own raised bed. From Pensacola, Florida, this is Jim Sewell, Eagle News. We live in interesting times.
Well, we know what Jim is going to build and has built. Let's find out what our correspondents who are joining us tonight, what they would build if they could build anything. So, guys, gather around the round table, the virtual round table, and we're just going to go through the list here, find out what it would be, and it doesn't have to be practical. I mean, things that I might want to build, I might not even have the skills to do other than to imagine them. So let the imagination run a little bit wild. There's no limits on your ability. Just tell me what it is. If you could, what would you build? We'll start with you, Arlene.
So I love arts and crafts. I like floral design. So one thing I would love to build somewhere in this house that I live in, whether it be a corner or what have you, is an arts and crafts room filled with all the supplies, with all the colorful papers. I get excited seeing stuff like that. So that is my reality thing that I would like to build. But
let's suspend reality for a minute.
Okay.
Suspend reality. What would you do then?
So I would love to have the ocean in my backyard. The beach, basically.
Not a tsunami. I hope you.
No, just the whole the whole beachfront kind of thing. The sound of the waves really soothes me, and just a place to kind of relax. That's something I would love to have. But during the winter, have that little fire pit somewhere there as well to keep myself warm. But yes, water, sand, the trees, depending, I guess, palm trees, what have you. That would make me really happy in my backyard.
And maid service to go with your own personal resort?
I'd have to think about that. I like to fend for myself.
Let's find out what somebody in California would do. Andre, what would you build if there were no limits and you could build it?
If there were no limits, Thomas?
No limits.
No limits? Well, I think I would build a Iron Man suit. because I've been a big fan of Iron Man and his suits, so that's something I would really want to build if there were no, outside reality, of course.
Okay, I've got to ask you: would you be out fighting crime then if you could wear this suit?
Of course.
So you want to be a crime fighter? Let's get back into reality a little bit. Again, no limits on your mechanical ability or whatever is required, your design ability. What else would you build?
If I could build something, it would be a full-suited gym with like all the weights, a basketball court, a field, because I really love like working out, and basketball is my love.
And gee, if you had that, there's no membership fee.
Exactly.
Exactly. Okay, Eliza, what would you build?
Okay, like you said, if I have no limits, I'd convert a van into a collapsible tiny home. They're very in right now. And then I'll use it as my library and art studio. And I'll drive it anywhere I want, any time of the year. And maybe ask Arlene to come with me.
Okay, I'll make a suggestion that you should include in there. And actually, I used to drive one of these many, many years ago, back in the late 70s when I was in radio, is put a little bit of a studio in it so that when you're off somewhere traveling and creating something, doing the intellectual creation, you could file a report back here to EBC.
Correct. I'll do just that, Thomas. I'll do just that.
Well, you just want a little corner in that. But yeah, we actually used to have a motorhome that was converted into a studio, and we went to a different town every day and did the afternoon music show from there.
Wow.
So yeah, it was kind of different. It was kind of a fun job. Let's suspend reality in your case. Now, what would you design?
Okay. It's still that van, that collapsible tiny home or van that I'll convert into my library and art studio. But like I said, I'll invite Arlene to drive around in it with me. But it will come with unlimited art supply, and I'll share them with Arlene. All unlimited art supply, whatever she needs: paper, paint, glue, anything you need, it's there.
Arts and crafts. Arts and crafts. Well, mine is kind of like that, but again, I'm a bit of a nerd. I would probably just redo my studio, build it properly so that we actually have a proper news set like you see on some of our bigger competitors. Something like that. Upgrade the electronics. Definitely want to upgrade the camera and the prompter. I mean,
how about your suspended reality version, Thomas?
My suspended reality version. I'm going to save that for a couple of minutes because there's some people I would want to invite along with that one. But I'm just wondering, is there anything else the three of you can think of that you would want, that you could construct? You look like you've got something on your mind there, Andre.
I actually do. I used to travel a lot pre-COVID, so something that will, I guess, cause no more traffic, especially here in LA.
I used to read about those back in when I was a kid, and this is back certainly after the dinosaurs went extinct, back in the 60s, in Popular Mechanics, a flying car. What do you think about flying cars?
Flying car sounds really great, but you never know, might get some air traffic up there as well.
Now that's the only problem is the way people drive on the ground. You want to be in the air with them. Don't know about that. Any other wild ideas from you, Eliza?
Nothing right now. Nothing's coming to me right now, but yeah, convert anything into a space that I'd love.
And Arlene?
I can't think of anything, but I'm going to take up Eliza on her plan. I'm excited.
Yeah, we We can take it to the ocean, Arlene.
Yes. Park it there.
And just park it there, yes.
Both of you can file reports from there. Well, okay, I'm going to suspend reality, and this is what I would do. And I'd want to do this for our frontline workers. I would want to build this 5-star vacation resort. Because don't you think all of what they have gone through, all of the overtime, some of them haven't even taken a vacation in a year. And the 12-hour days, the 24-hour shifts for some of these people that were in medical training and in even out of medical training, their whole life is at the hospital. Their whole life is caring for people. So I want to give them a break. I would want to build them a 5-star vacation resort with every kind of environment they might want. Because, you know, some people like to be in a tropical resort. Some people prefer a cooler part. So we could have separate pavilions for depending what people wanted and big enough to accommodate them all. Because that's what I think our frontliners deserve for all they've gone through with this pandemic, all the pain, the sacrifice, the hardship they've gone through to care for us. And I'm not only talking about healthcare workers, I'm talking about first responders, essential workers of all types. And there's a lot of them out there. Everybody out there on the front lines, you could stay at my 5-star resort free of charge. Free of charge. There'd be no charge at all. But I can't do it, unfortunately, because now we're back in reality. But that's what I would do. One thing we can do, though, we can recognize them now. So let's give them all a round of applause. Just want to say we appreciate you, and I hope, I really hope as vaccines become more common, as the restrictions are eased, as we start to enjoy our freedom, that we don't take things for granted, because we don't want to see you back there taking care of us again. We don't want to go through this again. Hopefully, as things ease up, we exercise some common sense, some good judgment, so we can prevent a third wave and for once and for all, beat this virus. That's today's program, Eagle News America. Thank you for joining us. I'm Thomas I. Likeness, and truly, we live in interesting times.
Ikaw kasi, iiwan mo ko.
With this ring, I promise, babalik ako.
And I promise, hihintayin kita.
Sa bawat pangako ng pag-ibig,